This conference will now be recorded.
All right, folks. So we're just doing a review for test number 2, and you'll need to know that the endocrine system, chapter 12, the cardiovascular blood, chapter 13, and cardiovascular, chapter 14, which will contain blood vessels and heart and such. That'll be present on your test number 2. Okay. Test number 2 will be 50 questions because you're going to have an additional amount of time in the testing area there. Because while one group A, is taking the practical exam, Group B will be taking the test, and then while Group B is taking the test, Group A will be then taking the test. Group B will be taking the practical. So it's going to switch off. So it's going to be 50 questions. Know that. Okay. So let's begin with the endocrine system, and we'll look at the endocrine notes in a moment there. But what I want you to keep in mind, folks, is that right. What I want you to keep in mind, folks, is that really with the endocrine system, knowing the glands that are present in the endocrine system, knowing as far as the cells and the different types of cells that produce the different types of hormones, you'll need to know that. And like I said, we'll just do a review, skimming through the chapter. You'll need to know as far as then the hormones that are being produced and pathology. So there'll be quite a few questions regarding if we have too much of a hormone, if we have too little of a hormone, how can that affect, okay, the human body, and how can that affect homeostasis? Okay. You also will need to have an idea and know the different structures. So knowing that, and I have provided for you all images regarding structures that are present within the endocrine system. And so what does the pineal gland produce? What is the pituitary, anterior and posterior? Do they both produce hormones? What about the hypothalamus? What's being produced there? What's being produced by the thyroid, the thymus, the pancreas, the adrenal glands, the gonads, as far as the testes in the male, the ovaries in the female. Okay? You need to know what hormones are being produced, and then again, what their action would be. And again, if we have too much or too little of a hormone, how can that affect homeostasis? Okay? Again, too, whenever we study any chapter, it's really important to review the functions of the system, right? So knowing the basic functions of a system is a key, crucial, important, please, okay? You'll need to know as far as the difference between autocrine, paracrine, and the endocrine hormones, okay? You'll need to know as far as hypothalamus, what's going on here as far as what is it producing, okay? So what hormones are being produced? Where are they going to, okay? You'll need to know that, so the hypophysis is the pituitary gland. There's the neurohypophysis and the adenohypophysis. What's the difference between the two? And what is the significance of the two? Again, the hormones that are being produced, so you need to review and look at all the hormones and have an understanding of what their action is. What is the action of prolactin, of luteinizing hormone? What's going on with FSH, okay? Growth hormone, thyroid stimulating hormone, right? You need to know what these hormones, what is their target tissue, and what is the action produced. And then again, if we have too much or too little of the hormone, how is that going to affect function and homeostasis? So growth hormone, big deal as far as knowing, what is dwarfism, gigantism, acromegaly? How about as far as for thyroid hormone, what's going on with cretinism, which is very similar to dwarfism, but there's differences though between the two. So don't get them confused is what I'm trying to say, because sometimes we can get different pathologies confused. So we can get issues as far as with issues with hypothyroidism and Cushing's, as well as with issues with hypocortisolism, right? So you understand, like there can be different, there can be similar symptoms, but different pathology and different etiology as far as what's going on with the hormones that are being affected. So you should go through this. You should know the different types of hormones and what's going on. I'm not going to really focus too much on what goes on as far as what's happening as far as the tract is concerned, as far as, but you should know, well, is the hypothalamus secreting hormones that are going to go to the posterior pituitary, which in turn the posterior pituitary will then release those hormones so that the posterior pituitary is not actually synthesizing these hormones that are being released, right? So you need to keep this all in mind, please. So you're seeing here, so reviewing images absolutely can be very important, okay? Folks, if you're having issues with your Wi-Fi, that can affect that when you see that people are coming and going from the class. If you're not hardwired connected into your whatever device you're using, that could be an issue. So if you're using Wi-Fi, maybe it's a good idea to try and get a Ethernet cable and connect it directly to whatever device you're using if you can. Right? If you find that you're dropping your ability to come in and out of the class. Okay, so getting hardwired can be very important. So I have my laptop connected to an Ethernet right to my router, and that really makes a difference. So you should know the difference and know what is T3 and T4, what do they represent, and have an understanding that they're both thyroid hormone, but one is going to be more potent than the other, right, as far as T3 is concerned, but there's going to be more present of T4 flowing through the body. I know also that in addition to thyroid hormone, T3 and T4, we have calcitonin that's being performed, that's being synthesized, and know what is the antagonist for calcitonin as far as PTH. So if one does one action, the other does an opposite reaction, right? So you should know what's going on with calcitonin, what's going on with PTH, right? And their effect on the body, and in particular on blood calcium levels. Knowing location of structures, knowing, so the adrenal glands, you should know that, as we went over in lab, that there are these three layers, these three zones on a GFR, right? Glomerulosa, fasciculata, reticularis. Reticularis is the deepest layer adjacent to the adrenal medulla, and the adrenal medulla has its nervous tissue. So you should know that. You should know that the cortex, those three layers, the cortex, that would be glandular tissue. The medullary portion of the adrenal glands, that's going to be nervous tissue and secreting epinephrine, norepinephrine, aka adrenaline, noradrenaline. Okay. Yeah. So you see here as far as Cushing's and also dealing with, so Cushing's having hypercortisolism and thinking about also hypothyroidism, very similar symptoms, understood, but different etiology. And the pancreas, as far as those pancreatic islets, right? And then, so what is actually then, yeah, so knowing what's going on as far as that the pancreatic islets, those are those little islands of endocrine tissue within the pancreas, right? So it's only a small percentage of the real tissue area of the pancreas. Primarily, it's digestive functions, right? So exocrine is primarily the function of the pancreas, but endocrine function, those pancreatic islets or these islets of Langerhans, knowing that the beta cells are producing insulin, alpha cells are producing glucagon, knowing that they work in opposition to each other as far as one is diminishing blood glucose levels, one is increasing blood glucose levels, and what's the action behind that? And knowing symptoms, right? And seeing here as far as we talked a little bit about testosterone, estrogen, progesterone, we talked about luteinizing hormone, we talked about also dealing with follicle stimulating hormone, prolactin, oxytocin. So yes, we're going to go into more detail regarding some things as far as the ovarian and uterine cycle when we look at the female reproductive system, but you still need to know these hormones and their basic function at present for this test. Thymosin for the thymus gland, right? And we're going to be talking about very soon the immune system and immune system function and the importance of the T cells and how, yes, they're maturing in the thymus gland. And then what is the significance of T cells as far as in specific immunity, specific immune function? The pineal gland, we talked about melatonin. Remember, don't get it confused with melanin. It's not melanin. Melanin is a pigment for the skin and for other structures of the body, right? Melatonin, this is what's going to chill the body out. It's going to allow the body to be calm as night comes and as it gets darker outside, whole circadian rhythm, right? It's important to recall that melatonin is also can be used as a sleep aid. Okay. So that's the PowerPoint there. And again, too, reviewing. I might have clicked on the endocrine pathologies. I'll have to give me just one moment, folks. I apologize. Yeah. Right. So I'm not going to go through this all, but I just want you to see that the importance of, folks, okay? So I'm going to tell you where to focus on in particular, right? So as far as knowing what's going on as far as the gigantism, acromegaly, dwarfism, diabetes insipidus, because it's different than diabetes mellitus. You should know the difference between the two, okay? Know what a goiter is. As far as the autoimmune thyroid disorders, as well as just hyperthyroidism and hypothyroidism. You should know that Graves' disease, Hashimoto's, are both considered autoimmune diseases, and they affect the thyroid. And how do they affect the thyroid gland? Okay. Myxedema, you should know that this is a term that we use for hypothyroidism. Again, not autoimmune, but know that that's a term, an AKA for hypothyroidism. Cretinism, it's a congenital form of hypothyroidism. You should know what would happen as a result of an increase or a decrease in parathyroid hormone. And if we know what the action of parathyroid hormone is, then we know, all right, if we have too much or if we have too little, how is it going to affect what goes on as far as blood calcium levels? Okay. Diabetes mellitus, you should know type 1, type 2, gestational, the differences between them. And you should know as aldosteronism, which would be hyperaldosteronism, right? Would be the same, aka also known as Conn's disease, hypersecretion of aldosterone, hypoaldosteronism, and what goes on as far as blood pressure. In particular, think about blood pressure when you're thinking of aldosterone, and then Cushing's and Addison's disease. Okay, and that's what we'll need you to make sure that you're knowing very well as far as endocrine system is concerned. Okay, let's go to the blood. All right, so here we're in chapter 13. So you should know that the terms, so you should know as far as the major components of blood. So what's going on as far as the plasma, as far as the formed elements, and why do we call them formed elements, and what are the formed elements? What do they represent? That would be the blood cells. So you should know as far as which are in greater percentage as far as the erythrocytes, leukocytes, and the thrombocytes. Realize that primarily it's erythrocytes that are going to be making up the percentage of the formed elements. And as far as the leukocytes are concerned, remember, never let monkeys eat bananas, as far as knowing, okay, so neutrophils, we have the highest amount, and basophils, we have the lowest amount as far as white blood cells are concerned, okay? And you should know again too, as we go into the next chapter also, as far as, so functions of the blood, functions of the heart, you know, and what goes on as far as vessels are concerned. Right? So you should, I just talked about that. You should know, how do we differentiate between them as far as their look and their appearance? If it's described to you, one of these cells, you should be able to then say, hey, well, that would be represent a monocyte. Monocytes differentiate and become macrophages. Macrophages are involved in phagocytosis. They're the cleanup crew of the body. And whether they're stationary in a tissue or they're flowing through the blood, macrophages play a very important role in recycling the components of old cells. You should know, as far as, so what is the composition of the plasma? Primarily it's water, right? But we also have these plasma proteins. And no, we're going to be talking more about the globulins as far as when we talk about gamma globulins, so antibodies. That'll be part of your immune function. We'll get into more detail as far as the different types of antibodies for the next chapter, okay? Or actually, not the next one, the following. And as far as the different, what other types of things are actually, solutes are being transported by the blood, as far as, so we have ions, nutrients, waste products, gases, right? Oxygen, CO2. We have enzymes and hormones and such. So, you know, there's a lot that's being transported through the blood. And remember, the blood is a fluid connective tissue, right? As far as know what this term means and what we know the significance of red bone marrow. So we've talked about in last semester there, as far as yellow and red marrow. And so yellow marrow, think adipose tissue, red marrow, think production of blood cells and such. And you should know that a reticulocyte, so reticulocytes are immature red blood cells. They contain a nucleus, right? So red blood cells are anucleate, right? They last about 4 months, right? 120 days. And know the significance of EPO. Transportation. So you should know, right? As you look at this here, so you should know that, right? Primarily, oxygen is transported attached to hemoglobin in the red blood cell. Know this, that 23% of CO2 is attached to hemoglobin. Primarily, it's traveling in the plasma as bicarbonate, okay? And 7% actually CO2 is transporting in the plasma, and 70% as bicarbonate. And then 23%, only 23% of CO2 transported in the red blood cell itself. You should know what represents granular and agranular leukocytes, white blood cells. Should be in there. Back here. Okay. So you should know why would neutrophils, eosinophils, basophils, monocytes, and lymphocytes, why would they be in higher numbers as a result of what? Okay? What would be the trigger? What would be the reason why they would be in higher numbers? Okay? In particular, you should know again that we talked about that monocytes differentiate and become macrophages involved in phagocytosis. Also, we'll talk about this quite a bit as far as antigen presenting cell, APC, and know that monocytes as well as dendritic cells are very important to phagocytize different cells that are non-self and be able to then present pieces of them, antigens, on their plasma membrane in order to stimulate the immune response and really help a specific immune response in particular. And you should know what represents inflammation, signs and symptoms, talked about. So clotting, you know, just review for me, please, but I wouldn't, this would be more important to really know as far as, so a thrombus is a clot, an embolus is a clot, is a thrombus that's circulating, and infarction is when we have tissues are killed as a result of loss of blood supply. So as a result of a clot, right, an embolism, right, so you take a clot, thrombus, it circulates, embolus, it gets stuck in an area in a smaller vessel, and it blocks blood flow. So anything distal to the clot, right, would be dead tissue, would die as a result of lack of blood supply, lack of oxygen and nutrients. The clotting mechanism, right, know that it's an example of positive feedback and know just the basics of what's going on here. The term agglutination, this grouping of the blood vessel, the red blood cells, as a result of a transfusion reaction. So we have red blood cells and antibodies causing the red blood cells that are non-self and that are not, so if I am type A blood and I receive a type B blood transfusion, so the antibodies that I have in my blood for type B would allow for the type B red blood cells, erythrocytes, to clump together, to agglutinate. And this would lead to, could lead to blockage of tiny vessels, right? And it also can lead to a lack of oxygen being delivered to the tissues. So not a good thing, transfusion reaction. And you need to know as far as blood typing and what goes on with that. Now, those that are going to be in my Thursday lab this week, you will have the opportunity to do a blood typing lab. And we will also be taking blood pressure in the lab, as well as having the opportunity to review the different models and such that we're going to be on, that will be on your practical exam coming up next Thursday. Okay? And so also understand regarding erythroblastosis fetalis and Rh factor, what's the key issue as far as that would lead to a problem for the baby. So a negative mom, a positive child, first encounter, it's going to lead to then what? It's going to have a situation where mom can develop an immune response to Rh factor. And then subsequent pregnancies, if the child is Rh positive, this can be a problem as far as mom creating an immune response to her own child, and this could be deadly. Okay, all right. So let's minimize that. Let's go over to the cardiovascular chapter. And so the key issue with this chapter here, I have to tell you primarily, it's going to be understanding and knowing what takes place as far as the heart is concerned. That's really primarily what I'm going to focus on for the questions and such. Not as many questions really on vascularity. I'll be focusing on vascularity in the practical exam. So really, it's going to be primarily the focus on what's taking place with the heart, what's taking place with coronary circulation. How about also the nervous system as far as conductive pathway of the heart? What's the pacemaker of the heart, the SA node? SA node to AV bundle, bundle of His, aka bundle of His, then the bundle branches to the Purkinje fibers, that kind of a thing. I'll be asking questions regarding. You should know the coverings of the heart. Right, the coverings of the heart, the layers of the heart, the myocardium, that's the muscular portion of the heart, so that's what contracts, right? And you need to know the types of muscle that are present. So we know that pectinate muscle in the atria, trabeculae carnae in the ventricles, as well as the papillary muscles. You'll need to know, so here's something that's important that I would ask of you. I will describe for you blood flow. If I'll say something along the lines of blood flow is being backed up, or no, how about this? Blood flow is actually leaking into a certain chamber as a result of what valve is being affected, or blood flow is actually backflowing into a certain chamber or a certain vessel. What valve could be not functioning properly? Okay, so you need to remember, what's going on with the flow of blood, the different vessels that are feeding the different chambers or taking blood from the chambers. You need to remember all of that for the test number 2. Okay, you need to know regarding fetal circulation as far as fossa ovalis, as far as ligamentum arteriosum. Okay. And important to know as far as the difference between pulmonic and systemic circulation, and what's taking place as far as the movement of oxygen, and is the blood oxygen poor, oxygen rich? You should understand that as far as where it's coming from. Important to know the intercalated discs as far as allowing for the transmission of and the contraction of skeletal muscle in chambers. So atria contract, ventricles contract, and it's as a result of these different connections that allow for them to contract as a unit. Again, I mentioned about the conduction pathway. So the electrocardiogram, right? So the ECG, EKG, you should know P wave, QRS complex, and T wave. Okay, you should know what's taking place as far as depolarization of the atria and repolarization of the atria, where that's taking place. You should know as far as ventricular depolarization and ventricular repolarization, where that's taking place, right? During which aspects of the ECG. Terms systole and diastole, important to know as far as those terms. As far as heart sounds are concerned, is it as a result of them opening or closing the valves, or a combination of the two? Talked about fetal circulation. I'm not really going to get into calculations and such like that, but you should know stroke volume, you should know heart rate, you should know the term mean arterial pressure, you should know what those terms represent. You should know the influence of the autonomic nervous system upon what's taking place in the cardiovascular system, parasympathetic and sympathetic stimulation. You should know as far as what's taking place as far as these different receptors present. So these are pressure receptors, baroreceptors, pH, CO2, O2. You should have an understanding as far as, so what's the deal with that? Why, how can that play a role in understanding what's taking place with the cardiovascular system? You should know that if we have an increase in blood volume, right? Increase in blood volume, increase in blood pressure. If I decrease blood volume, I decrease blood pressure. We'll be talking about that more in the urinary system. So, okay. How can, right, as far as body temp, what can that effect have on the body, upon the cardiovascular system? As far as potassium ions, what can that role have? The blood vessels, I would just ask that you know that there are the differences between an artery and a vein. Know that valves are present in veins. Know that we have these different layers as far as the intima, media, and adventitia. Know that the inner lining of a blood vessel would be continuous with the chambers of the heart as far as the atria and ventricles. Okay. And you need to know these different types of capillaries. I need you to be able to differentiate between a continuous, fenestrated, and sinusoidal. Like I said before, as far as veins are concerned, they're the valves that are present. Now, like I said, as far as blood pressure, I'm not going to ask questions regarding blood pressure for this test. So that'll be on the next test. Actually, or maybe no, maybe in the fourth test actually, because yeah, it'll be the fourth test, because I'm going to tie in information with the urinary system, with blood pressure, and so I'm going to just I'll keep that portion of the cardiovascular system. Blood pressure questions, that'll be for test number 4 with the urinary system. Okay. Okay. Let's do this. Yeah, because what I've understood. Yeah, so that's going to be Yeah, so let's look at this here now. As far as I have two notes for you all, as far as additional notes now here that you've already had. As far as, so with blood disorders are concerned, you'll need to know the different types of anemias, please. You'll need to know as far as what happens when we have high levels of red blood cells or low levels, high levels of white blood cells or low levels, high levels of platelets or low levels. And regarding the terms here as far as thrombus, embolus, embolism, right? We talked about that just in the PowerPoint there as far as the clot, moving clot, and a clot that's obstructing and blocking a vessel. Right? I won't be asking anything regarding the anticoagulants, but just give them there for information. But hemophilia, I won't ask regarding the clotting factor, but no, it's 8 and 9, right? But you can have, there's two different disorders, two different types of hemophilia that I'm asking you to know about and know what exactly impact it can have on the body. Then as we go to the cardiovascular pathologies, so terms like a pericarditis, what's taking place with that as far as the covering of the heart, what's taking place as far as myocarditis, endocarditis, and we're looking at layers of the heart and the different areas there and what happens when they are having some type of infection and inflammation present. Angina, myocardial infarction, CAD, right? So these are terms that you need to know. You need to know athero and arteriosclerosis, okay? You need to know as far as the atherosclerosis, as far as the hardening and hardening of the arteries and the plaques that are building up in these arteries. As far as what's taking place with heart rate and such, so bradycardia and tachycardia, you should know what those represent. You should know what an arrhythmia would be. And in particular, as far as mitral valve prolapse and rheumatic fever, stenotic valve. So stenosis has to do with a narrowing. So what would happen if we have a narrowing taking place of the opening and how it's going to restrict blood flow through that valve? Rheumatic fever as a result of a bacterial infection and how this can damage valves. Mitral valve prolapse, right? So the valves are not, they're incompetent. They're not functioning like they properly should as far as creating a seal. Right? And lastly, this is a very important, I want you to know, as far as congestive heart failure. So this little blurb right here. So folks, those of you that are going into nursing and such, you're going to be seeing patients, unfortunately, suffering from congestive heart failure and such. And so you need to know, so what happens when we have left-sided heart failure? So what's going to happen as far as, so the left side of the heart is sending blood to where? To the systemic circulation. But if we're having an incompetent left side of the heart functioning, so then if we're receiving blood from the pulmonic circulation, wouldn't it make sense if the left side of the heart's not pumping properly, then we're going to have a backup into the pulmonary circulation, so pulmonary congestion. Whereas with right side of the heart, so we're having what? Right side of the heart is receiving blood from systemic circulation. Well, if that right side of the heart is not pumping properly, then we're going to have a backup as far as the peripheral congestion, and so think edema in the extremities. So, and know that once you have one side, both sides will eventually be affected. All right. Okay, so I've kind of gone through like a very quick pace, going through what we've what's going to be on the test, and so please focus on that information. Okay. Now, when it comes to the practical examination, so let's see here. Right. So recall that we have the structures. We have you have the brain. So the full brain I didn't ask a lot of information regarding the full brain. So recall that, the cerebral hemispheres, you're going to have longitudinal fissure that separates the cerebral hemispheres. You're going to have what a gyrus and a sulcus would be. What's the central sulcus and the precentral gyrus, postcentral gyrus. We're looking also at the cranial nerve number 1 and 2, right? So you're looking at olfactory, olfactory bulbs, olfactory tract, optic nerve, optic tract, optic chiasma, right? You're looking at the structures of the sagittal head. So you're thinking of, so you just go down from the cingulate gyrus to the corpus callosum to the septum pellucidum to the fornix to the pineal gland to the optic chiasma to the pituitary gland. You think third ventricle with the thalamus and the hypothalamus. You're thinking then also with the cerebral aqueduct and the fourth ventricle, cerebellum, the arbor vitae, thinking the corpora quadrigemina, the cerebral peduncles, the pons, medulla oblongata, the spinal cord, right? So remember, you've got to have that and know that very well. As far as the heart is concerned, the ear. Question? Question? Okay. So as far as the ear is concerned, you need to then review as far as those structures from the external, middle, and internal ear, right? So know the auricle, the pinna, the external auditory canal or acoustic meatus. You should know the tympanic membrane, the malleus, the incus, the stapes, the oval window, the vestibule, the semicircular canals, and you should know the cochlea. You should know what's going on as far as the branches of the vestibulocochlear nerve, cranial nerve number 8, right? And the areas there and what branches go into where, structures of the inner ear. The auditory canal, aka the eustachian tube, that is doing what? That's equalizing the pressure in the middle ear. Okay? As far as the heart, you should know all the vessels. We went over all the vessels, all the chambers, the auricles, right? So the auricles on the external portion, you should know coronary circulation. You should remember that pulmonary arteries and pulmonary veins carry different type blood than arteries and veins carry throughout systemic circulation. Know the different blood vessels and such, and we went over that flat model. In addition to the muscular head, which had vascularity on it, and also the heart itself. As far as the endocrine sides are concerned, right? So you need to know, so think about this as far as anterior and posterior pituitary. Recall that posterior pituitary is going to stain lighter than anterior pituitary, right? You'll also remember that, let's see, thyroid, parathyroid, as far as tissue is concerned. Remember, thyroid tissue is very distinct in its appearance, right? You'll recall that we'll have to know pituitary, not pituitary, the pancreas, the pancreatic islets, and what they look like, and how to be able to identify those and that tissue. You should also know as far as the adrenal glands and knowing the difference between the cortex and the 3 layers and the medullary region of the adrenal glands. Okay. So those are just, remember, and I'll post, like I said, tomorrow morning, I will post the endocrine images that I do have for you all. Okay. So I'll probably put them in, let's see, I'll put them in documents and resources, and they'll be in, they'll be in unit 2 in documents and resources. Okay, the endocrine slides. And then you'll have to be able to, and those of you that had lab already, right, for lab 3, in the practical for coming up, you'll have to know blood typing. So we went over how to do blood typing in the lab and what we would be looking for. So if I have a blood type that I have on, I have like one of those little plastic cards, and it shows a reaction. And those of you that didn't have it yet, don't worry, you'll learn this. But what it would represent. Is it type A, type AB, type B, type O? Is it positive or negative? You'll have to be able to tell me that on 1 or 2 of those little plastic cards that I'll have out for you during the practical exam. And then just as far as blood pressure technique, I'm not going to focus on testing you on for the practical and blood pressure technique, because I'm going to be focusing on blood pressure really in urinary system. I'm not going to ask that you demonstrate the blood pressure technique for this practical, but for the last practical, I will ask that. Okay, I'm just going to switch it around to practical number 2 for blood pressure technique, that you'll have to show me and demonstrate for me how you would take blood pressure. All right, folks, very good. So